A physician can, if he has a suspicion, so we can here a physician can at least divide the patient in three groups. One, if there are ECG changes or of a full blown heart attack, then he should give some blood thinners orally as well as some IV or subcutaneous medicines as blood thinners. He should try to see about the hemodynamics, like how are the pulse and BP, and he should try and arrange shifting the patient to a tertiary care hospital as soon as possible for an immediate angiogram and angioplasty. In the meantime, he should inform the patient family also, so that they can arrange for the requisite money and help. If possible, he should communicate with that tertiary care center also, so that they are also prepared with their team and no time is or minimum time is lost in the process. If there is no place immediately available for shifting the patient, and within few minutes or 2 hours, 30 minutes to half an hour, that the patient can be shifted to a tertiary care center, he can probably give some blood thinners that is termed as thrombolysis can try and bust the clot and open the artery, although that is successful in 60 to 70% cases only, but that he can try. The second group is where there are ECG changes, but they are less than full-blown acute heart attack. That is mostly termed as acute coronary insufficiency or unstable angina. Then he can give the treatment, and again, it's not that kind of an acute emergency, but the patient should again refer to a cardiologist at a tertiary care center so that he can evaluate and do the needful further. The third group is where the ECG is normal. Then the patient can still be advised about the possibility, the small possibility that remains about the cardiac thing, but then he can give the preliminary treatment. The patient can see the doctor the next day.
Okay, so we've known that how a patient would be handled at a secondary care facility, and we'll come over to the fact that how a tertiary care center would manage a patient. In the meanwhile, there has not been a lot of talk about CT scan being used for the angiography of the heart, and you do it on a cath lab. Would you be able to tell what's really the difference, and who are the ideal candidates which would suit either of the two procedures?
As we were discussing, that the first group where it is a clear-cut heart attack by an ECG and the symptomatology, there is no role of CT angiogram or any stress test. The patient has to go to the cath lab and do the best thing to do. And if as predictable by the ECG criteria, that we are going to see an occluded artery, and opening that will be life-saving. The second group where the ECG shows some changes, not amounting to a complete acute ST revision heart attack, then the patient can be stabilized with the medical management, although at a setup where the monitoring facility and facility to save the life is available, because some patient, despite medical management, can get a complete full-blown heart attack even being in hospital. So we should be having that capability, or we should be transferring the patient in the meantime to a facility where an angiography and angioplasty can be done. The third thing, plus admitting to a tertiary care center also helps two more ways. The patient might have a low BP during a process of acute heart attack. That can be helped by balloon pump placement. Patient might have arrhythmias. Those may be life-threatening, and that has to be controlled with medication as well as cardioversion, that is giving an electric shock. The third group, where the ECG is normal and the symptoms are also not classical of an angina, in that group probably a CT scan angiogram is a good option, because if the symptoms are at rest and the patient has risk factors, then still it can be an acute coronary insufficiency, that is termed as acute onset angina or unstable angina. So before the advent of CT coronary angiogram, we used to subject the patient for a stress test, like a treadmill test or a stress echo or a stress thallium. But with the advent of CT coronary angiogram is safer, and it will clarify the issues much better